Hey Facebook, back again. These weeks go by fast, as I often say. I'm doing it a little later than usual on Thursday night. I finally just made it back home after a series of events in Hartford and in the district, and wanted to share a few updates with you. First of all, as some of you may have heard, earlier this week, the Office of Health Strategy approved the merger between HealthQuest, which owns Sharon Hospital, and Western Connecticut Health Network. The approval of that merger was not surprising. We all expected that. But what was interesting and somewhat surprising in a good way is that the approval for the merger, which came in the form of an order from the Office of Health Strategy, has teeth in it. And some significant provisions and conditions that HealthQuest and the merged entity, which they're calling Nuvance, will have to comply with. And some of this is quite new, as I've talked to a number of people both in the Office of Health Strategy and people involved in healthcare in the region, and who perceive this as a renewed or newly vigorous effort to enforce the needs of, make sure that the needs of the community are being met, and that promises that get made in these certificates of need, or CONs as they're called, actually get enforced and they're not empty promises. So this was all seen as very optimistic. And so I'm about to get a little bit in the weeds on some of this, and so I apologize for that. But I do think details are important. And this document, the approval, I think is very, has cause for optimism, but the follow through will also be very important. And I do think that OHS, the Office of Health Strategy, is very interested in making sure there is follow through. But community engagement has been a huge part of this. And those of us who went to that hearing in Danbury over the merger, who made a lot of specific suggestions, will see some of those suggestions showing up in the stipulations that are made in the agreement. So community activism was really important. It really matters, and the agreement contains promises for future community engagement. So it will be important for us to stay tuned into this. I want to just highlight some of the things in the agreement. There are a number of specific requirements that the merged entity, or Nuvance, will have to submit specific reports on a variety of issues and hold regular public meetings where the community will be able to ask questions. And they'll have to be in convenient locations and noticed in advance so that people can participate in them for real. It will have to engage with community stakeholders in determining what the needs of the community are, which is also important. It interestingly requires the appointment of an independent monitor. And that's a technique that has shown up in some of these approvals before, but this one has a couple of new things in it. First of all, the monitor is going to be named or selected by the Office of Health Strategy, not by Nuvance. Nuvance can participate in the list of people who can be chosen, that OHS can choose from, but OHS will make the selection, and the monitor is accountable to OHS. So that's really important because it will help ensure that this monitor is truly independent. Second of all, this monitor has really wide authority, had a broad ability to enforce the stipulations of this merger approval. So I think that's a really important part of the teeth in this. There is also some language in the approval order that is specific to obstetrics and gynecology, and it's positive and specific, but it retains some of the caveats that we've seen before. So again, community engagement for me is really important and remains important, and I want us to stay watchful. We're not done yet. So specifically, Nuvance will be required to submit an affirmation attesting that it will maintain a series of services in each of their hospitals, including Sharon Hospital, and among those services is specifically obstetrics and gynecology. So that they will be required to have that in each of the hospitals. There's also a paragraph that specifically requires that Nuvance shall maintain obstetrics and gynecology physician staffing levels at Sharon Hospital to meet the needs of the community served. Now, that's good news, but some of you may recognize that language was a version of that appeared in the original certificate of need that HealthQuest submitted when it purchased Sharon Hospital from Essent originally. So we've seen that before, and it has caveats to it, and we've seen those at play before. So what's interesting is that this stipulation goes on to be a little bit specific. It says it requires Nuvens to make commercially reasonable efforts to employ a minimum of 2 full-time equivalent obstetrics and gynecology physicians. So that's more specific, and they have to demonstrate that they've made these efforts, and that that 2 physicians be hired or on staff. But it has a caveat subject to availability of appropriate physicians and community needs. So it will be important for us to continue to advocate for the needs of the community here. So I'm very optimistic about this. I think this is a really important first step, but it is a first step, and follow through will be really important. So kudos to all of the Save Sharon Hospital and all of you who showed up at the various rallies, and also very importantly at that hearing in Danbury. I do think OHS listened to us and is trying to make this work. So back to the legislature. As I think I've mentioned, committee deadlines are starting to pass. I happen to sit on committees that have fairly late deadlines, and I'm just a tad jealous of some colleagues whose committee deadlines have all passed. For me, only the Environment Committee has passed what is called the joint filing deadline, which is essentially the deadline for that committee to submit its bills, to pass bills out of that will go on to the full legislature. Judiciary Committee has its deadline is this coming Friday, April 12th. We had our last public hearing yesterday, and now we start the process of caucusing on bills and voting bills out of committee. We had hearings on a lot of bills, and probably not all of them will make it through to a vote, so there's a lot of maneuvering going on in terms of priorities. And interestingly, every committee has a different way to go about this. For example, in Environment, we tended to have public hearings, and then we'd schedule committee meetings and vote on some bills, and then we'd have some more hearings and vote on bills. In Judiciary, what tends to happen is we have a lot of hearings, and most of the votes on those bills that we've had hearings on will take place next week. So, for example, I have a hold on my schedule every day next week for Judiciary Committee hearings, and I understand that those may go quite late into the evening, so I may be camping out of my office for the first time. We'll see how that goes. So we've had public hearings on a range of issues that we haven't bills we haven't had votes on, including issues relating to solitary confinement, and particularly its use in the juvenile justice arena, which is kind of shocking. And the importance here is that sometimes solitary confinement is not called solitary confinement. It's called something else. And we're trying to narrow that and still understand exactly when it's being used and limit it to very, very unique circumstances. And I'm going to highlight a few things here, but it's a long list. So we are hearings on diversity on jury panels, housing protections for victims of sexual violence, the use of jailhouse witnesses and how to make sure that disclosure about those witnesses, adequate disclosure, is made to criminal defenders. And yes, the legalization of cannabis is one of the big bills, and along with that, the erasure of records for those who have been convicted of that in the past. So there will be a lot to share about judiciary bills next week when I come back to you. The Appropriations Committee has the latest deadline of all committees. Its joint filing deadline is May 2nd. So where we are with that committee is we are starting to have what are called the final decision-making meetings of all the subcommittees. And it's an interesting dance, because those meetings are not the only place that information or views get conferred. So what happens is that each committee has its final decision-making committee, in which a budget is a draft budget for that subject area is put together, and then it's sent to leadership. And that includes the chairs of committee from the House and the Senate. It also includes the ranking members on that committee, and a conversation will go from there. So what I'm learning about that process is those committees meetings are not the only place in which to advocate for certain things, and so information gets transmitted to leadership in a variety of ways, and I'm doing that. So it is a very challenging process, but lots more to do. I'm also starting, as those committee deadlines pass, I am starting to write up a new file of reviewing the bills that have come out of other committees, which is a daunting process because each committee passes a lot of bills. And as it turns out, a lot of the bills that make it through committees are unanimous. They're not controversial. And so I and other colleagues are banding together to try to make two piles. One, that the bills that were unanimously passed by committee, which we can put in one pile, and the others, some are passed by straight up partisan votes, and some are bipartisan. Some you get people on both sides of that. And so those bills that have that aren't unanimous, I'm starting to create a file on so that I can have the opportunity to ask some questions and educate myself before I have to vote on the floor of the House. And last, I just want to highlight a few events that I got to attend this week. I went to a wine tasting in Kent, which is always fun, for the Kent Land Trust at Artifacts. Got to see a lot of Kent people there who were present in force to support their land trust. I also went to an open house for the Kids Play Museum in Torrington, which is a children's museum. And Representative Michelle Cook and I always make it a point that we think it's very important that we climb the treehouse and experience some of the events there just to make sure that they're really good for kids. And it's good to go and pretend to be a kid again and recall those Sunday afternoons when I took my 3 small children to Children's Museum to try to keep them entertained and busy. We also had a meeting this week at the COG offices in Goshen, which brought together the leaders and organizers of a lot of affordable housing initiatives throughout the COG. And that was driven in part by the fact that the Governor Lamont's budget includes what's being called a debt diet, which essentially pretty severely restricts the amount of bonding that the state that he wants the state to do, which I heartily applaud because I think that's one of the ways that the state has kicked the can down the road for many years. However, it does bite in particular circumstances, and for reasons that we're not really clear on yet, one of the areas that was pretty drastically restricted was bond funding for affordable housing, which is an important piece of the funding puzzle for affordable housing initiatives, which in our region at least are largely really done. There are many pieces to that puzzle. There are public-private partnerships. They involve federal funding, state funding, private funding, and they're intricate puzzles. And having one of the cases that we need to make sure we make to the governor and to the bonding committee is that shutting that off severely in a particular year, rather as opposed to maintaining a steady level of bond funding for those initiatives, can have disastrous effects because these are sometimes fragile coalitions, and if they've been at work on them for many years, and if suddenly when the project is ready to go, there's no funding available, sometimes that coalition falls apart and you lose so much time and wasted resources. So many of us got together in Goshen to talk about that and to figure out how to make our case to try to get the most ready projects the funding that they need. I also went to a meeting of the Goshen Board of Selectmen, which is one of the boards of selectmen that meets most frequently. And the meeting that I went to was one at which the Goshen Business Circle was presenting a proposal regarding forming an economic development plan, which are always interesting conversations. And the Goshen Business Circle has a pretty robust membership. A lot of businesses in Goshen are active in it or receiving information from it. And of course, as usual, there's just a core of people who are really energetic and really interested in formulating an economic plan for Goshen that's consistent with the town and that honors and celebrates the rural character of Goshen, which is not dissimilar from many towns in the region. So that was a really interesting meeting. Glad I was there. And finally, tonight, I went to a meeting at Northwestern Connecticut Community College of the American Association of University Women. And this was I was part of a panel of regional women leaders, each of whom had contributed in some way to the particular and helped or organized something or made connections for the young, really impressive young women who were part of this group. And honestly, most of the time I would prefer that they had been on the panel because they're so inspiring and their stories are so incredible. But that was a really great moment for us to share stories and wisdom and inspiration and advice and make connections between all kinds of people in the room. And those of us on the panel had so much fun together. We had a hard time leaving. So that's a really great networking opportunity for all of us. So I was happy to be part of that. So that's it for today. Got a big week in judiciary next week, as I've said, and hope you have a great evening. See you next week. Bye.